This is Salem Home, the only personal care home in the city of Winkler. It has 145 beds, and they're always full. At any given time, there are about 50 people on the wait list to get in. 2 years ago, the elevator started breaking down, causing concern that one day it will just stop working altogether, leaving vulnerable residents trapped on the second floor. Karen Oliveira is the CEO of Salem Home.
The risk of it failing is big, so we didn't want to risk having the residents, all 35 on the second floor, and all of a sudden it stops working, and then they are stuck, literally stuck up there.
The elevator repairs are estimated to cost $200,000, which Shared Health said it would pay for. But when? The province approved funding for a new elevator 2 years ago. Then in March, Salem Home put out a tender to find a company to do the work. But 7 months later, and the government still hasn't handed over the money.
But this is now the whole empty unit.
Oliveira says in September, staff here decided they couldn't wait any longer and moved 26 of the 35 patients down to the first floor. They couldn't move them all because 9 residents are on the behavior ward and can't be around other seniors. She said without a functioning elevator, it would be very difficult to move people in an emergency. But now, the care home has 26 empty beds and no way to fill them.
People can't be admitted to the hospital, so they are sitting in the ER because the beds are full with people waiting to go somewhere else. And so decreasing the ER wait time, to me, is almost like directly linked to PCH.
There are currently 54 people on the wait list for Salem Home. About 20 of them are taking up space in hospital beds until they can get a bed here. The average wait time is 15 months. Health Minister Uzoma Asagwara told CBC News they were concerned about the delays in communication between Salem Home and the government.
I want to hear directly from folks across the healthcare system in our communities to know how we can support them. And so this was one of those situations where when we were made aware of what was going on, we worked very hard and very quickly to get it addressed.
Days after CBC News contacted the government, Oliveira was sent an email from a Manitoba health policy analyst confirming Shared Health would reimburse the care home for the project and that work on the elevator would begin in January. Caroline Bargood, CBC News, Winkler.